We're here at the IAS meeting in Amsterdam. We're here with Rosanna Peeling, and she is with the London School of Hygiene and Tropical Medicine, and we really appreciate you taking the time to visit with us on HCV and your presentation. I'm going to allow you to tell us what it is that you're bringing to the conference.
Yes. I think hepatitis C infections are important co-infection of HIV. People who are HIV positive are 6 times more likely to acquire hepatitis C. And also women who are hepatitis C positive are at twice the risk of transmitting their infection to their babies compared to women who are not. And so I think that there's a lot of awareness about testing for HIV, but there isn't a lot of awareness about testing for hepatitis. And as is a co-infection, we really would like to advocate for HIV programs to incorporate HCV testing, especially in key populations such as men who have sex with men and injection drug users, to be screened for hepatitis C so that they could be put on treatment. Up till recently, testing for hepatitis C was pretty horrendous and also very expensive. But now because what you have to do is not only do you have an antibody test to determine whether you've been exposed to hepatitis C, and then those who are exposed will be followed with RNA tests to know whether you are shedding virus, in which case then you would be selected for treatment. And then as you put on treatment, there are tests for monitoring success of treatment. Many countries do not have the pan-genotypic drugs, and so you have to we have to determine what your genotype is in order to select the right drug, as well as many tests to test for toxicity, etc. And so the cost is somewhere between $200 and $1,000, which is not affordable for most country programs. But now with the better drugs that are directly acting drugs, as well as they are pan-genotypic, and also we have better tests for confirmation. And because the drugs act so quickly and so well, we don't really need to monitor the progress. So we could just confirm virus and then do one at the end to see whether you're cleared of the virus. And in between, only do a few tests to monitor toxicity and liver function. And so it's now brought down to between about $40 to $100. So that makes it much more affordable. The testing algorithm is much simpler, and so it could be easily incorporated into HIV and HCV control program. The other thing that makes it more attractive to screen is that we have now tests that could be done at the point of care. So these are very user-friendly lateral flow tests that are like dipstick tests that you could use with a finger prick, so you don't need to take venous blood. And the results are available in 15 minutes. And so it could be done everywhere where HIV tests are done. And also, we now have multiplex tests that could test for HIV and HCV at the same time with 1 drop of blood, as well as HCV, HIV, and syphilis, which, for men who have sex with men, those are the co-infections that are very important. So those kind of testing efficiencies makes it a lot easier and a lot cheaper to be able to screen. So we have the tools, we have the drugs, So why don't we get started?
Right, and once you're cured, you're no longer going to be able to infect someone else.
Yes.
Unless
That's
you're
right.
reinfected. Now
Yes.
that is the possibility.
Yeah.
So that's another issue.
Yes.
Is to be wary of that possibility.
Yes, yes, certainly that's true, and I think there are, once you are linked to care, there are algorithms there in terms of monitoring how well you're doing, your status, and also the risk of co-infection.
Reinfection, yeah. So I appreciate the work that you're doing and getting this message out, and the new, and this will evolve. We're going to
Yes,
see
of course.
other
Yes.
ways to simplify and modify and make it less expensive, and still, I mean, it's getting really good, but it's.
Yeah, so I think that what physicians ideally really like is not only a rapid test that you could get in 15 minutes to know whether your patient's been exposed, but a rapid test to determine viremia, right? So that in one clinic visit, you know both, instead of having to come back later for that test. There are HCV core antigen tests that are being developed so that they could be used in, as a lateral flow format. Currently, we don't have a very easy to use or as rapid molecular tests to determine viremia as we do for antibody, unfortunately. So we're looking forward to that. That would be the ideal. That's the ideal scenario that we shoot for. A rapid molecular test that could follow the antibody test right away instead of having. Currently, the molecular tests, I mean, there are point of care instruments where you could do the molecular test, but the quickest one is about 58 minutes, and so still a long time.
No reason to wait.
No reason to wait.
Do it
yes,
now.
yes, certainly. Yeah.
Thank you so much for being here.
Thank you.